Microbiological surveillance in Operation Theatre. Today's learning objectives. After completing this lesson, you will be able to understand purpose of microbiological surveillance, requisites for the surveillance, monitoring of consumables, monitoring of air, monitoring of OT surfaces, and monitoring of sterilization process. Purpose of microbiological surveillance to ensure sterilization procedures are adequate, to detect the load of microbial flora in the OT and thus preventing post-operative infections like endophthalmitis. When should the surveillance be done? Regularly, as defined in the protocol, when a hospital is newly constructed or renovated, when there has been outbreak of endophthalmitis, sporadic or cluster infections. Requisites for the microbiological surveillance. Culture plates, soya bean case in digestive agar, Robertson's cooked meat media, sterile cotton swabs, sterile glass container, and biological indicators. Monitoring the consumables. Ringer lactate. Send one ringer lactate in every new batch for pH and culture testing. Acceptable pH 5.5 to 7. Culture report should be negative. Discard the batch with abnormal pH value and positive culture report. Tap water and RO water. Monitoring is done once in 15 days. Fill 3/4 of 30 ml sterile bottles with RO and tap water separately. Send them to the lab for microbiological culture test. Culture report will be obtained after 5 days of testing. Acceptable tap water less than 500 bacterial colonies, RO water less than 100 bacterial colonies. Not acceptable is presence of fungus, E. coli, and Pseudomonas species. Monitoring of air settle plate method. Once a month test is done early morning before the OT starts. Soybean casein digest agar is used. Culture plates kept at right and left side in the sterile zone of OT and near the door is exposed for 30 minutes. Samples should be collected from the AHU room and from split AC. Nobody should enter the OT or the AHU room in those 30 minutes. Send it to the microbiology for culture. Culture report will be obtained after 5 days. Number of bacterial colonies should be less than 20, which is acceptable. More than 20 is not acceptable. Even one fungal colony is not acceptable. Monitoring of surfaces in the OT, wall and floor, which is done once a month before the start of OT. Swabs from the floor as well as the wall of the OT are taken, inoculated in the Robertson's cooked meat media, or which is the anaerobic culture. Number of bacterial colonies less than 20 is acceptable, more than 20 is not acceptable. Even one fungal colony is not acceptable. Monitoring of sterilization procedures. To determine the efficacy of sterilization by autoclave and ETO, which is checked once a week. Send the indicator back to the microbiology for culture. No growth is acceptable. So, microbiology surveillance in the OT, which is a summary. Name of the culture, the frequency, and the growth. RL or visco culture for every batch, no growth. OT culture, monthly, less than 20 colonies. RO water, every 15 days, less than 100 colonies. Tap water, every 15 days, less than 500 colonies. Chemical analysis report, monthly, within defined parameters. Biological indicator, weekly, no growth. Water culture. If water culture shows bacterial colonies out of acceptable range, we should not use that particular tank water for cleaning purpose. Instead, we use hot water to clean instruments and hand washing. The tank which showed bacterial growth out of range should be cleaned with hot water and repeat culture should be sent. Once the bacterial count is within acceptable range, the tank can be used for cleaning purpose. Role of an MLOP in microbiological surveillance in the OT. OT cleaning and fumigation should be done on the day before, according to the protocol, to keep the culture plate, swab, containers ready on the previous day. Ensure to wear proper protective equipment, gowns, cap, and mask while collecting samples. Follow proper sample collection methods following strict aseptic precautions. To check for the culture growth, pH value of the ringer lactate, and viscoelastics on every new batch. Properly maintained the standards and timing while collecting samples. Take the samples carefully in a separate container and hand over to the microbiology lab. Ensure proper monitoring and documentation are done at appropriate intervals. If there is any variation from normal values, immediately inform the concerned in charge person and follow it up with proper action. Thank you.